Do you struggle to make healthier food choices with all the misleading and confusing packaging around? You deserve clarity. Introducing the Octagonal warning label. Easy to read design, simple language that everyone can understand. Bold and hard to miss. A label backed by sound scientific research and proven to help you correctly, quickly, and easily identify products high in sugar, sodium, and fat. The Octagonal warning label is the label you deserve. And right now, CARICOM countries are voting on whether or not to approve this label. So show your support for the Octagonal warning label at healthycaribbean.org. Because you deserve the label that works best.
Good morning, good afternoon. Welcome all to our webinar, What is Happening with Food Labels in CARICOM? The Role of Octagonal Warning Labels in Transforming the Health Landscape. On behalf of our President and the Board of Directors of the Healthy Caribbean Coalition, as well as our partners, PAHO, CARPHA, the OECS Commission, UNICEF, and the Caribbean Public Health Law Forum, I would like to thank you for taking time out of your day to join us. My name is Maisha Hutton, and I'm the Executive Director of the Healthy Caribbean Coalition, and I will be your moderator. The aim of this webinar is to bring together key regional stakeholders to provide an update on the status of front-of-package nutrition labels in CARICOM, in particular around the regional vote on the final drafts of the CARICOM Regional Standard for the labeling of prepackaged foods, or the FDCRS 5, which contains the science-backed, high-end, front-of-package octagonal warning label and the PAHO nutrient profile model. CARICOM member states are currently voting on whether or not to approve this standard. CrossQ, the regional entity mandated to lead on regional standard development, has asked CARICOM countries to indicate their support or otherwise for the FDCRS 5 and by extension, the octagonal warning label. Advocates and health authorities have responded. HCC and partners have launched a regional digital campaign. Octagonal warning labels help consumers act on facts, and you'll hear more about this today. Public health leaders, as they did in 2021, have once again mobilized in support of the octagonal warning label. We are proud to launch today an open letter from 7 regional institutions, 3 chairs of national NCD commissions from Barbados, Grenada, and Jamaica, 7 HCC member civil society organizations, and our patron, Sir George Allain. The letter calls on CARICOM's national standards bodies, the entities charged with arriving at national positions, urging their stakeholders representing diverse sectors of society and senior policymakers across key ministries to support the approval of the final draft standard. These leaders in public health and nutrition are joined in their endorsement of the octagonal warning label by over 40 regional organizations and almost 700 Caribbean citizens, including public health professionals and academics, all sending an unequivocal message that the Caribbean people have the right to the clear and honest label that works the best. Over the course of this webinar, you're going to hear more about why we need this label and the strong scientific evidence behind it. Before we start, let's go over some quick housekeeping. Please use the Q&A function for your questions and feel free to share comments in the chat. Our speakers and panelists will be monitoring, reviewing, and responding in real time. So let's get started. I'd like to introduce our first set of speakers who will provide brief opening remarks, beginning with Sir Trevor Hassell and followed by Dr. Anselm Hennis, Director in the Department of NCDs and Mental Health at PAHO, Dr. Lisa Indar, she is the Director for Surveillance, Disease Prevention and Control Division at CARPHA, Dr. Didicus Jules, who is the Director General of the OECS Commission, and Mr. Peter Bult, who is the UNICEF representative to the Eastern Caribbean area. So let's get started first with Sir Trevor Hassell, President of the HCC. Sir Trevor, you have the floor. Sir Trevor, your mic is muted.
So thanks very much, Maisha. And it's a pleasure for me to make a few observations and remarks. And let me begin by re-emphasizing and telling the story of the front of package warning labels in the Caribbean, an important and critically needed public health measure. In 2018, CARICOM heads of governments endorsed front of package warning labels as an essential step toward healthier diets and the reduction of disability and death from NCDs. This position by leaders of the region was taken in recognition of the fact that greater awareness of the content of food products was one of many needed to reduce NCD's overweight and obesity. The decision of Caribbean leaders in turn led to the initiation by CROSQ, the CARICOM Regional Organization for Standards and Quality, of a regional consultation process to revise the draft of the CARICOM Regional Standard for the labeling of prepackaged foods to include front of package labeling. Over the ensuing 5 years, there has been extensive consultation and studies performed and led on the one hand by the Caribbean public health community and on the other by the Caribbean private sector, a party with a direct financial vested interest. For its part, the HCC, together with its member organizations, its civil society network, its volunteers, and its partners, based on the results of studies performed by the public health community, has educated and advocated for the CARICOM Regional Standard for the labeling of prepackaged foods to include FOPWL, using the high-in octagonal warning label and the PAHO nutrient profile model as the system most likely to assist consumers in correctly, easily, and quickly identifying foods high in sugars, fats, and sodium. In 2021, CARICOM member states voted on the final draft standard, which included the octagonal warning labels and the Pan American Health Organization nutrient profile model to inform labeling thresholds. The voting outcome fell short of the percentage required for passage, resulted in another round of consultations in 2022 and in early 2023, and a further vote by CARICOM member states on the adoption of the foods. Today's webinar is yet another HCC-led effort to educate, to inform and advocate, and is in support of the recently launched HCC-led digital campaign, Octagonal Warning Labels Helps Consumers Act on Facts, a campaign that I hope everyone will actively support, promote, and share widely. The results of a recent PAHO-led study conducted in Barbados showed that octagonal warning labels have the potential to avert 16% of NCD deaths, while saving governments $733 million annually in mortality costs. Octagonal warning labels support healthy school nutrition policies, aid the perception of sugary sweetened beverages as a health risk, encourages reformulation to healthier products and the production of new healthy products, and supports nutritional guidelines. We in the HCC, together with our partners, urge member states to vote for the high-end octagonal warning label. The time is now to do the right thing, to assist our people in easily, correctly, and quickly identifying foods high in sugars, fats, and sodium. For as the director of PAHO said recently, despite entrenched commercial and financial interests that hinder progress, Caribbean people deserve to have facts about what they are eating. And so in closing, let me use this opportunity to recognize and acknowledge the tremendous leadership, commitment, and technical expertise provided by regional institutions such as PAHO, CARPHA, UNICEF, the University of the West Indies, and the OECS Commission, supported by an ever-increasing extensive regional network of, for the most part, young people who have, over the past many months, come together throughout the Caribbean to work tirelessly to improve the health of Caribbean people through healthier food choices. Thank you very much, Maisha.
Thank you, Sir Trevor. We'd now like to invite remarks which are pre-recorded from Dr. Anselm Hennis.
Good day and welcome to this webinar on front of package warning labels in the Caribbean. This topic has tremendous importance, not only for the Caribbean, but for the entire region of the Americas. We must recognize that Caribbean nations embarked on the endeavor to prevent and control NCD's non-communicable diseases long before the cross-cue process began in 2018. In 2007, the heads of state and government of the Caribbean met in Trinidad and Tobago and united behind the Port of Spain Declaration that has become a landmark achievement in global public health and includes the commitment of heads to support mandating the labeling of foods or such measures as are necessary to indicate their nutritional content through the establishment of the appropriate regional capability. And realizing this commitment is an important part of why we are here today. A Caribbean child born in 2007 and his or her siblings are members of a cohort whose rates of obesity among the highest in the world. Children and adolescents aged 5 to 19 years have among the highest mean body mass index, which are measures of obesity and overweight for these age groups in the entire world. These are our children, grandchildren, nieces and nephews who've all grown up in highly obesogenic or obesity-promoting environments where increased consumption of ultra-processed food products or junk food has become the norm. And this has been accompanied by decreasing levels of physical activity. These children and adolescents are not only overweight and obese, but are also on track to become obese adults who will develop hypertension, heart disease, diabetes, increased risk of stroke, as well as specific cancers. Since 2007, robust scientific evidence has been accumulating from around the world on front of package warning labels and their effectiveness. Data from the Caribbean now show a direct linkage between non-communicable diseases and the increased availability, affordability, and consumption of ultra-processed food and drink products with unhealthy profiles. Furthermore, global and regional research shows that concise, easy to understand front of package warning labels impact consumers' purchase behaviors, resulting in them buying and consuming healthier foods. Front of package warning labels therefore work by providing easily understandable information to consumers about the content of harmful critical nutrients, namely sugars, saturated fats, and sodium in food products, which allows them to make healthier food choices. As such, front of package warning labels are an appropriate tool for protecting and saving lives in the Caribbean. With robust science and evidence-based best practices on our side, we at the Pan American Health Organization continue to encourage governments and heads of state to prioritize policies that support healthier food environments. NCDs pose a serious threat not only to health, but also to sustainable economic development, especially in small island developing states. It is therefore no surprise that Caribbean Ministers of Health made a call to action in the 2023 Bridgetown Declaration on NCDs and mental health. In closing, I would like to thank our distinguished presenters and participants for their contributions to an active involvement in this important discussion. Let us journey together with determination and commitment to create a healthier future for all. Thank you.
Thank you for those pre-recorded remarks from Dr. Anselm Hennis. I'd now like to invite Dr. Lisa Indar from CARPHA to provide her own opening remarks. Dr. Indar, I believe your mic is muted. No, we can't. Let's see. What we could do is we could go ahead with the remarks, the next set of remarks, and come back to you and see if you can sort out the volume. Okay, there we go. So can we please have the pre-recorded remarks from Dr. Didicus Jules, the Director General of the OECS Commission.
Ladies and gentlemen, distinguished guests, and fellow advocates of healthy and informed living. Octagonal warning labeling is a critical initiative that must be actioned for many reasons. First and foremost, these labels are frontline tools in the fight against unhealthy food with excessive sugars, fats, and salt. Consumer awareness can empower buyers to make intelligent, healthy choices about what they eat. This can benefit Caribbean manufacturers by opening new trade opportunities for tropical products that respond to the growing global consciousness and choice for healthy foods. The OECS is proud to be part of this effort that weaves the threads of health, consumer rights, and cross-border collaboration into a cohesive tapestry. Navigating the complex landscape of nutrition should not be a privilege, but a fundamental right accessible to all. Through the implementation of octagonal food labels, we seek to fortify public health by fostering informed food choices and nudging manufacturers towards reformulating their products to healthier alternatives. In a world where non-communicable diseases such as diabetes and cardiovascular conditions continue to climb the ladder of global health threats, it is imperative that we act collectively to stem this tide. The octagonal food labeling system not only assists in making immediate, healthier food choices, but also works as a subtle yet constant reminder of the pertinence of nutritional vigilance. As a region, embracing this system amplifies our unified commitment towards safeguarding the health and well-being of our citizens. It emphasizes our collective pursuit to advocate for transparency, accountability, and consumer empowerment in the food industry across our integrated nations. Moreover, our unified adoption of octagonal food labeling builds a platform for harmonization among our member countries, simplifying trade processes and reducing barriers by establishing a common language in food health and safety standards. This in turn ensures that the foods traversing our borders comply with a collective, stringent and health-focused standard, protecting and promoting the welfare of our regional populace. Let us illuminate a lifetime of healthier choices for our people. Let us envisage a future where the simplicity of an octagon ignites a profound change in our food industry, propelling our region towards a horizon where our citizens are empowered, our industries are responsible, and our nations stand united under the banner of health, sustainability, and cooperative prosperity. As we forge ahead, may our efforts seed a future where each octagon serves as a shield, safeguarding the health of our communities and bolstering the foundation upon which our regional integration stands tall. Thank you for your attention, and may our path forward be shaped by collective responsibility, actionable change, and sustained well-being.
Powerful remarks from Dr. Jules. Thank you for those powerful opening remarks. Dr. Indar, is your audio working now? Let's check and see.
Can you all hear me?
Yes, we can. Wonderful. Over to you.
Right. Good morning. Greetings Thank you for inviting CARPHA to participate in this important inaugural initiative aimed at overall reduction of diet-related and non-communicable diseases in our region and empowering our citizens to live healthier lives, healthier lives. The NCD's burden in the region is overwhelming our health systems. We all know that. The statistics are alarming. More than a third of mortality from NCDs, 38.1% in the Caribbean countries in 2016 were premature, occurring before age 70 years. One of the contributing factors is the poor quality of foods that are readily accessible to the population and not knowing the contents and effects that they may have on health. CARPHA is therefore pleased to partner with the Pan American Health Organization, the Organization of the Eastern Caribbean Commission, the United Nations Children Fund, and the Caribbean Public Health Law Forum in this important initiative. CARPHA welcomes this Octagonal warning label initiative and fully supports the ongoing campaign. Our communications and communicable disease and injury teams at CARPHA are actively engaged in this campaign. Most of us depend on tools to assist us with everyday activities for convenience or out of real need. Specifically, FOPWL and specifically OWL is one such essential tool for helping consumers to make informed choices about the food they eat and for improving public health. The objectives of this initiative are quite clear, and so it is the right time to step up and to ensure that awareness of the detrimental effect of ultra-processed products high in sugars, fats, and sodium do exist. This awareness should hopefully bring about a movement for policy change in support for these warning labels. This has been ongoing for some time now, and there have been several conversations surrounding the urgency of introducing front-of-package warning labels in the Caribbean with a wide cross-section of the society in attendance. There have been progress. I encourage everyone to go to the HC webpage. Sign the petition in support of ActOnFacts campaign. CARPHA will continue to engage with its partners to ensure front-of-package warning labels become the standard as we all work together to bring about a healthier, safer Caribbean people. Thank you very much.
Thank you, Dr. Indar. Well worth the wait. And now over to Mr. Peter Bult. He is the UNICEF representative for the Eastern area. Mr. Bult.
Thank you, Maisha, and good morning, everybody. Warm greetings from UNICEF, especially to also my partners from the Healthy Caribbean Coalition, to PAHO, CARPHA, the OECS Commission, the Caribbean Public Health Law Forum, and to the distinguished panel members, civil society champions, the media, and all of us, 185 of us that have joined us here this morning for this timely and important event. Once again, we are gathered to address one of the most critical issues our children face: how to grow up well and stay healthy in an environment saturated by food too high in fat, sugar, and salt, foods that can damage their health and by extension negatively impact their future and that of our societies. The UN Convention on the Rights of the Child states that parties should act appropriately to combat disease and all forms of malnutrition. Every child has the right to adequate nutrition. Yet today, the need to protect, promote, and support good nutrition has never been greater. We are only too aware that obesity is a key risk factor for non-communicable diseases, the main cause of death in our region. A 2023 UNICEF report showed that in countries covered by our office for the Eastern Caribbean Area Office, between 25 and 33% of children aged 5 to 19 are overweight or obese. This is unacceptable. The impact of obesity goes well beyond the risk of NCDs. Children living with overweight and obesity may also experience psychological and psychosocial impacts, such as weight stigma, social isolation, depression, low self-esteem, and poor educational attainment. The economic cost of obesity is also startling. In 2019, the global healthcare costs attributed to obesity were estimated at more than $990 billion per year, and the impact of inaction is projected to cost most countries 3.6% of GDP by 2060. There is solid evidence that one of the key tools to promote better nutrition is the Octagonal warning label, which helps us make informed choices about what we give our children. And it works because it is easily understood by adults and children alike. Chile introduced the Black Octagonal warning label in 2016, and research among mothers showed that they had changed their behavior because of their children telling them not to buy unhealthy foods. Children also can indeed be change agents and will tell us what they think and what they want and what they need. UNICEF is proud to be part of the Octagonal warning labels Help Consumer Act on Facts campaign and fully supports advocating with member states to do the right thing and adopt these labels across the Caribbean. We need to do more for our children, alongside other interventions such as promoting healthy school nutrition policies and increased physical activity. Adopting these warning labels can make a profound difference to the lives and the health of our children. Let's give them that chance. Thank you, especially Maisha and team at the Healthy Caribbean Coalition for bringing us all together this morning and leading on this important campaign. You can count on UNICEF to continue our support. Good morning.
Thank you, Peter, and we've valued our relationship with UNICEF over the years, and thank you for being a partner on this campaign once again. So thanks to all for your remarks. You set the scene, you told us, what are octagonal warning labels and why we need them. And you also shared the work that you've been doing in your respective organizations to create healthy food environments for both adults and children. We now go on to the second part of our webinar, where we will invite some presentations. So the first presentation is from Ms. Tamara Marie. Tammy is the communications consultant with the HCC and the genius behind our campaigns. And she's been leading on this campaign, which is out right now, which you'll hear more about in a moment. Tammy, the floor is yours.
Good morning, everyone, and thanks, Maisha, for the introduction. So the HCC designed this campaign with wide consultation from regional and national partners, including HSFB, HFJ, JAN, to really advocate and build support for the octagonal warning labels, the front of package warning labeling system in the current final draft regional standard. Simply put, people need a clear and easy way to make healthier purchases, and the octagonal warning labels help consumers act on facts by delivering simplified and at-a-glance nutritional information. As you'll see from the materials, they not only highlight consumer empowerment, but they also call on decision and policy makers to act on facts rather than industry rhetoric, and support a front-of-pack labeling system that's backed by robust scientific evidence, free from conflict of interest.
Let's be honest, modern diets aren't that healthy. We're eating less fresh whole foods and much more ultra-processed food products high in sugars, sodium, and fats. And we are suffering for it, with the leading causes of our sickness and death being from complications related to obesity, diabetes, hypertension. It's not easy to choose healthy when the marketing of these products is misleading and aggressive, and the label's confusing. You deserve clarity. You deserve science-backed labeling, proven to help you correctly, quickly, and easily identify those products high in sugars, sodium, and fat. The octagonal warning label is the label we deserve. It's the label we need. And right now, CARICOM countries are voting on whether or not to approve this label. So show your support for the octagonal warning label at healthycaribbean.org. Because you deserve the label that works best.
Over to you, Maisha.
Thank you, Tammy. Our next presenter is Dr. Fabio Gomez. He is no stranger to the HCC and no stranger to the region, especially on this issue. He is the Nutrition and Physical Activity Advisor at PAHO, and I'm delighted to invite you, Fabio, to present on the warning labels and some research which is hot off the press that PAHO has led on. Over to you, Fabio.
Thank you very much, Maisha. It's a pleasure to join this webinar today, and I'm really fortunate to share this opportunity in giving an overview of the evidence that supports the octagonal warning labels and why it works best for the population, and also how important it is to have a nutrient profile model of PAHO attached and applied to that so that we can really achieve an effective measure. And I think it's really important for us is to make the case why the products that are to be regulated need to be regulated. And we know that all forms of malnutrition, they are expressions of sabotage to healthy and sustainable food systems. And that climate and non-climate environmental changes are both consequence and cause of unhealthy and sustainable food systems. And so I wanted to give a quick overview on why it is important and why ultra-processed products are really the driving element of the food systems. They are both impacting the NCDs and other forms of malnutrition, but also the environment itself, because it's a really important matter for all of us as well. So in terms of the impact of ultra-processed products in NCDs and other forms of malnutrition, it starts very early, damaging breastfeeding and complementary feeding. We know from studies that the higher intake of ultra-processed products within children and infants with 6 to 24 months is already reducing the continuation of breastfeeding. It's increasing the intake of saturated fat, sugars, and sodium, and reducing the consumption of fruits and vegetables. And also mothers that have a higher consumption of ultra-processed products also have increased introduction of ultra-processed products in the complementary feeding of their child with 6 to 24 months. And if we also go out there in the different countries all around the world and check what happens when populations eat ultra-processed products, we'll see that in any population, in any part of the world that this has been studied, every time ultra-processed products is eating more, then we have a higher energy density, more sugar, more fats, more saturated fats, and more trans fats in the diet, but also less fiber, less vitamins, less minerals, less protein. And that not only because the products have a bad nutrient profile, it has excessive amounts of the nutrients that we are concerned, like sugar, salt, and fats, but also they have a no-nutrient profile, meaning characteristics of their design that makes us eat more, such as being easier to chew, to crush, or to cut, having low satiety or weak satiation, which is just keeping us hungry and making us overeat, also having us allowing us to eat faster and not compensate when we're eating too much calories as if we were eating real foods, in addition to have additives that also have negative effects on NCDs as well. We have systematic reviews showing not only that the ultra-processed products harm the diet, but also health as well. And we're not only looking into individual papers anymore now, but systematic reviews that bring many studies showing that ultra-processed products are linked with cardiovascular disease, diabetes, overweight, and obesity, depression, and other mental health conditions as well. So it's really clear that ultra-processed products is super harmful to health, but also there's a clear link on how they impact the environment as well. And the first clear one is really how much the packaging of ultra-processed products is impacting with the toxic waste they generate. And as you know, the most pollutant plastic pollutant company in the world is an ultra-processed product company as well. And that means reducing ultra-processed products will also help that. So this is the first one, and we don't have a chance with recycling by just saying, well, we could do ultra-processed products, but we can just recycle those amount of plastics. But if we look into the capacity of the world, even the high-income countries to recycle, it's not even by 2060, we're gonna reach just 12% of what we could do. So just 12% of the plastic that we see in the environment. We're gonna make to the second use, and this is with all the improvement that could be made by 2060. And that means we just cannot rely on recycling. We need to reduce the consumption of those products that are bringing plastic to the environment. And one could also say, well, but what if we just use paper or paperboard as part of the package? Usually, ultra-processed products will be connected, they will put together paperboard paper, but also they will also have plastic. But even if they didn't have plastic, the inks that are usually used in these products, they also have toxic metals or other toxic components in the ink of these, the printing of these packagings that will also lay down in the environment as something that will increase the toxic waste that we have. So the less ultra-processed we have in our consumption in our countries, the less toxic waste we'll probably have. There's also an important reduction and improvement to agriculture, because ultra-processed products are basically dependent on 4 ingredients: wheat. It's essential for them to have at least wheat, maize, corn, sugarcane, and soya. So and all these ingredients, they are really dependent on industrial agriculture, which have a great impact on agricultural poisoning, increasing those, crop dilution, which is just impoverishing the foods that we have, even fruits and vegetables that we are growing in those industrial ways of agriculture, and erosion of ecosystemic defense. And this is just one example of how agricultural insects have been lost their biodiversity, and we're compromising the agriculture worldwide. This is coming from the journal Natures and other journals on that. Also increased on greenhouse gas emissions, and also compromising the water flow that is essential based on the health of the soil. And we have clear evidence and concrete evidence that the diets that are dependent on ultra-processed products are really the ones that are leveraging the greenhouse gas emissions and also water. We don't see non-processed products changing that. And this is a study was done comparing 30 years in Brazil, comparing diets that are based on ultra-processed products and the non-processed products. And you see the ultra-processed products really increasing the greenhouse gas emissions and water use by more than 3 times. So we need to regulate these products. And one of the key elements of that regulation is really applying the labeling so that people can easily identify those. And we know that front of pack warning labels are the ones that can quickly, easily, and provide more relevant information, more useful information, and also have the better chance to change decision and purchase. And there's many studies that have been done before we get to the octagonal warning labels, looking into different shapes, different colors, different sizes, where it should be placed. All that has been thoroughly studied in different countries, in Chile, in Uruguay, in Australia, Canada, UK, the United States, showing that the system that we're looking at now is really the one that performs best. We also have done several randomized controlled trials in different countries in Central America and also in the Caribbean, including one done in Jamaica, that demonstrates that octagonal warning labels perform best. Then here we have the example of GDA or nutrition facts up front, showing that what we have above the number 1 is really showing that the advantage, it's the number or the proportion of advantage of octagonal warning labels over the other system that's being compared here. In this case, the GDA. So as we see in Jamaica, the octagonal warning labels double, has double the capacity of consumers in correctly identify the least harmful option when compared to a nutrition facts up front, for instance. Similar results when you're comparing to the traffic light system, also performs best than the traffic light system, and also performs best than the single icon high-end system that we can see on the right-hand side. So indeed, the octagonal warning labels, not only with international evidence, but also local evidence from the Caribbean, shows that consumers made the best choice in their intention to buy the least harmful products more often, and also correctly identify the least harmful options and the nutrients in excess in products more often. And we have not only the evidence that they work best in the Caribbean. These are the results from Jamaica that were published in the British Medical Journal, but also the evidence that demonstrate that they work for different age groups, gender, education, and people in different with different reported non-communicable diseases and related risk factors. So they will work best for any age group, gender, etc. And that means it's gonna be effective for the entire population in the Caribbean. Also bringing more equity, because we know that sometimes the information that is brought by nutrition facts, for instance, is really imbalanced based on socioeconomic or education level of the population. We have many impact studies from countries that have done already taken the measure, and it's already happening there. So in Chile, more than 90% of the population, the first 6 months already changed their decision for a better decision. In Peru, we saw sales of carbonated drinks and cookies dropping the first 6 months. First 10 days of implementation in Uruguay, we already saw more than 50% of the people changing their behavior to a better purchase decision. And we have also unique data from Chile showing that actual purchases of products that have high-end warnings were reduced. And this is demonstrating finally that really, if we have the octagonal warning labels on those products, they're going to reduce the sales of those products. And the recent study that we've completed is that based on the expected impact that we have from octagonal warning labels that have been fully studied in different countries, we can now estimate how much the diet and this study was done in Barbados with the data from 24-hour recall showing how much the diet could change if octagonal warning labels were in place compared to just having the status quo, which right now is just having anything and actually becoming a proposal to have all the systems and allow all the systems. It's just the status quo, which confuses a lot the consumer. So if we compare the status quo or the baseline with a situation where the octagonal warning labels were present in Barbados, we would see drops in the energy intake, total fat intake, saturated fat intake, added sugars intake, and also salt intake. And these reductions would translate in an aversion or delay of 16% of the deaths due to NCDs in Barbados, including 57% from cardiovascular disease, 29% from diabetes, 7% from kidney diseases, 2% from liver disease, and 5% from cancers. And if we take all that averted deaths and calculate how much this would translate into savings for the country, this would account for a $732.8 million just in 1 year. And one of the important lessons that we learned from this whole process in supporting different countries is, besides reducing the purchase of products that have high-end warnings, octagonal warning labels, we also see the increase of products that don't have octagonal warning labels. And this shows us two things. One, there's the opportunity for industry to expand the sales of products that don't have those warnings, but also to show that it's really important for us to identify and to define which products should have the warning labels. Because if we don't have all the products that are excessive in these nutrients with a high with an octagonal warning label, we're gonna bring the population to increase consumption of products that are still excessive in those nutrients without them knowing, because we're not putting the warnings there. So it's really important that we use the nutrient profile model to define which products have to have the octagonal warning labels. So all products that are excessive in these nutrients, they have a warning. Otherwise, they're going to increase and they're going to harm and imbalance the diet of the population. And this data shows that, and we have analyzed the data of the diets of more than 125,000 people in 9 countries, including one country from the Caribbean, which is Barbados, showing that if the population, when the population consumes products that are excessive in one of these nutrients, according to the PAHO nutrient profile model of PAHO, then their chances to exceed the WHO intake goals is 2 or 4.5 times higher than if they were not consuming those products. So it's really important that we have all the products that should have received a warning label, octagonal warning label, based on the nutrient profile model thresholds. And I'll stop here and happy to take any questions, comments. Thank you very much.
Thank you, Fabio, for an excellent presentation that took us through such a wealth of evidence. We're going to shortly go into a panel discussion, and after that, we'll take questions. Before we do that, though, I am going to just provide a bit of background. We've learned about this exciting new regional campaign. We've heard data from Fabio, as you just said, but now we have this panel coming up. But I want to talk about some of the additional context around where we've been. So this is our second time around the block. We had a vote in 2021 where 6 of 15 member states supported the octagonal warning label. Antigua and Barbuda, Barbados, the Bahamas, Dominica, St. Lucia, and Suriname. 3 opposed, Grenada, Guyana, and Jamaica. And the remaining 6 countries of the 15 CARICOM member states abstained. Abstentions arise out of a variety of reasons, when there's lack of consensus or the member state does not feel that they've had an opportunity to have a truly consultative process. Abstentions do not count in the denominator. So in 2021, 6 of 9, or 66%, was insufficient to meet the 75% threshold, which is needed to advance the final draft to the next stage, where it goes back to cross-Q, then it goes off to COTED, and then you have a regional standard. So the standard was then relegated back to a draft standard and sent out yet again for further regional consultations, which took place over 2022 and 2023. Ultimately, in March this year, 75% of CARICOM Regional Technical Subcommittee, there are 12 countries which are tasked with the national consultation. Greater than 75% of those countries accepted the draft standard, which contained the OWL, or octagonal warning label, which triggered elevation yet again to the final draft standard and advancing to the regional vote, which is currently underway. And so here we are now, 2 weeks out from the October 14th deadline. So member states must submit their votes by October 14th to cross-Q. So the big question is, how will member states vote this time around? Will countries who supported the standard in 2021 maintain their support? What about those countries who rejected the standard or abstained? Has there mounting evidence like what we just heard from Dr. Gomez? Will it sway these countries and those who are charged with making decisions at the national level? The thing is, despite a lot of this evidence, we know that there's still some lingering questions about the octagonal warning labels. What are the implementation costs to manufacturers and governments? Will the octagonal warning labels hamper trade? How can we use the octagonal warning labels with trade partners who are not using these labels? And then there are broader questions around process, transparency, who gets to vote and how, and conflict of interest, which connects to wider concerns or issues around commercial determinants of health. So let's dig into some of these questions with our panel of experts. And I'd like to invite our panelists now to turn their cameras on. We have Ms. Samantha Moit, who is the Chief Nutrition Officer in the Nutrition Unit at the Ministry of Health and Wellness and Environment in Antigua and Barbuda. Ms. Nicole Foster, who is a lecturer and faculty of law and the head of the Law and Health Research Unit at the University of the West Indies, Cave Hill, and she's also HCC Policy Advisor. Ms. Isabel Barbosa, she is a senior associate and adjunct law professor at the O'Neill Institute for National and Global Health Law at the Georgetown University Law Center. Mr. Luis Galicia, who is a PAHO international consultant on sodium reduction, and also past life, he was at the Ministry of Health in Uruguay. And Dr. Fabio Gomez will also be joining our panel. Great. So let's get started with the questions. And I am going to start with Nicole. Let me pull these questions up right here. So hi, Nicole, let's begin with you. Many of the concerns about the final draft standard, in particular the octagonal warning label, relate to trade. How will the octagonal warning label potentially impact trade in the Caribbean?
Thanks, Maisha. So the idea is that front-of-back warning labels are a trade issue because, at least in principle, there's an impact on market access. So the logic of the system is, assuming that it's implemented as a mandatory standard, you wouldn't get access to the particular market without having your product having these labels on it. Now, how you manage that process, so there's a clear connection to trade. It doesn't, however, have to be all doom and gloom. It is really a question of how you manage that process. And there are many ways in which you can minimize those costs, but also to try to share those costs, but also look at it as an opportunity to create new entrepreneurial opportunities. And so we have seen, for example, in Latin America, where we have quite significant implementation of the octagonal warning labels, that we've seen in Mexico and Uruguay and some of the other territories, and I'm sure some of the panelists here who are from those territories may speak to it as well, how they've been able to maneuver in this space as small states, or relatively small compared to some of the other players in the market, in terms of stuff such as having stickers attached to the product rather than having to have the exporter themselves create a whole new label. So they still produce the product as they did normally, but then these stickers are attached for the purposes of entry into the particular market, and those stickers can be managed privately, so to speak. So it doesn't have to be an additional burden and cost the government. But a point that I really want to stress here is that at the end of the day, I think we accept that there's a certain cost that comes with change. I was saying that in another interview. So we're moving from one system to another. There's necessarily going to be costs associated with that. And the question is, how do we manage that cost? And but more importantly, is the cost worthwhile? And we're saying yes, because at the end of the day, what we're talking about is our goal isn't about trade, our goal is about health. We heard Dr. Jules and our colleagues from UNICEF and PAHO, etc., speak powerfully about the dire health situation within our region, and in particular as it relates to our children. And so in that context, we recognize sometimes for something worthwhile, there's a cost. And the question is the cost worth it? And I would like to think we would all say absolutely 100%. Our children are worth it. We are worth it. And at the end of the day, our nations are worth it, because we know the cost, as PAHO and others were Fabio and others were speaking about. We know the economic costs that come with failure to address this very real problem that we have. So yes, there are trade impacts, but that is not the end of the story. It's a little bit more nuanced than that. And there are possibilities and abilities to manage this. The final point I want to make is in a CARICOM context. I think, and you know, we have always pushed very strongly, those of us working in the public health space, that what we want is octagonal warning labels, these black octagonal warning labels. There are a number of other models out there. And indeed, right now within the standard, we have some options. And the idea is, from a trade point of view, if we're serious about trade, if we want to minimize the dislocation that will come from implementation of this, it's important for all of us in CARICOM to go with the octagonal label. It doesn't make sense for, you know, 5 of us to have it and another 5 not have it, etc. That creates unnecessary stress and strain. And so that would be my final point in terms of trade. Thanks.
Thanks, Nicole. We may come back to some of those trade issues throughout the conversation. I want to turn to Luis now. Luis, it's great to see you again. You were with us in 2019. Luis used to work with the Ministry of Health in Uruguay, small country similar to the Caribbean, imports most of what you consume. Can you share some of the lessons learned? I think in particular, what I want to zoom in on here is Nicole touched on stickers. And stickers has been an issue, kind of a sticking point we've heard raised quite often with governments and also manufacturers. Can you talk a bit about the experience with stickers in Uruguay?
Yes, Maisha, thank you so much for the invitation. It's a pleasure to be here again. So first, I want to touch a little bit on the packaging, because usually we hear that companies do not modify their packaging for small countries or for small markets. And that was a point that was unsubstantiated in Uruguay, because some packaging is modified for sporting events, for promotions, for holidays, or even for some other regulations such as health or nutrition claims. It's constantly being changed. So that's a point that probably is not so true coming from the industry. And when FOPL was implemented in Uruguay, we saw that some manufacturers modified their packaging specifically for Uruguay, even being a small market. And also, a lot, I will say most of the importers used stickers. So stickers is been a regulation being used for a long time in Uruguay. We have a nutrition and food labeling regulation for Mercosur actually since 2006. So stickers have to be used to for all products coming into Uruguay if they come in a different language. For example, Portuguese, we received a lot of our products from Brazil or from other countries that come in English or in other languages. So that was being used for a long time. So when we implemented front-of-pack labeling, we had a lot of complaints from companies, but many of them during public consultation said that stickers had to be used in order to comply with this new regulation. So stickers had to be applied by the importer, by the manufacturer, or by anybody who wants to sell a product in Uruguay. And it has to be put on before it's released to the market. So the Uruguayan Technological Laboratory, which is a private company that operates as a public institution, is the one that ensures that the regulations are being complied with. So they, before releasing the product, they verify that they comply not only with front-of-pack labeling, but with all food regulations. So that's how it's being done in Uruguay, and the company pays for the stickers, and also the company pays a rate of the imported goods to that laboratory to verify that they are complying with the regulation before they go into the market.
Thank you, Luis. Very, very helpful information on the process and how it works in Uruguay. Useful for us as we hopefully look forward towards implementing here in the region. I want to come back to Fabio a bit. You know, we're talking about some of the kind of arguments that we're hearing around the octagonal warning label. And one of the significant ones that repeats itself is around the PAHO nutrient profile model. It's too strict. Many of the products on the market will have the label because the profile model is too strict. Fabio, can you tell us a little bit more about the nutrient profile model, how it was arrived at, and how it works, so that we can kind of clear the air on some of those misconceptions?
Sure, thank you, Maisha. Yeah, so the nutrient profile model of PAHO is not designed, you know, to make it more or less strict, to be more or less strict. We don't go and look into products, say we think this one should go in, this other one should not be regulated. We need to be very objective, because we know countries when they're defining their policies, they need a justification that can back them up, and that those numbers should come from the evidence and from the public health recommendation. WHO has a recommendation on how much sugar, how much fats, how much saturated fats, how much sodium we can eat. Those recommendations are all based on proportions. And why proportions? Because we have different energy requirements. A child has a different energy requirement, and hence they have different limits for sugars, for sodium, than an adult, and then, you know, other population groups. So that's why WHO recommendations are all based on proportions. So the PAHO nutrient profile also is applied to products in a proportional way that matches the WHO intake goals. That means when you're eating a product that doesn't have a high-end warning label, octagonal warning label, that means you have you'll be closer to the WHO intake goals. So and it's really important that countries use a threshold that is based on the WHO intake goals and PAHO nutrient profile model, because this will give them the basis to justify the measure and ensure that this is going to end as an effective measure. Because you may change the purchase of the products with octagonal warning labels, but if you just place in a few products, just, you know, with an arbitrary threshold, you're not going to make a change to the diet. So if you really want to achieve your end goal, you need to adopt the nutrient profile model PAHO, which is linked with the WHO intake goals. Thank you.
Fabio, a quick follow-up question there. What if a manufacturer says, you know, I'm having trouble with my product reaching that threshold and I really want to avoid the stamp? Can we just lower the threshold so that my product won't attract the stamp? How do you respond to that?
So the measure, is not designed to change the composition. As primary objective is not to change the composition of the product. If there are some products that we're not going to be able to meet thresholds because it's part of their identity to have excessive amount of sugar or excessive amount of sodium, we just need to inform the population. That's the only thing that we're doing. And then the population, they can make that decision. If they're going to consume, they're going to consume less or try to, trying to find alternatives in the markets, etc. But there, there are some products they will not be able to reduce to the thresholds because they are, as part of their identity, excessive on those nutrients. But we need to inform the population. We cannot just say, let's remove this warning and let people eat, pretending that the product is not excessive. We need to tell the truth.
Thank you for that, Fabio. Now we're moving on to Isabel Barbosa. So before we get to your question, Isa, I thought you could just give a quick summary to the audience because you're new to our kind of general audience of what you do at the O'Neill Institute.
Thank you so much, Maisha. It's a pleasure to be here with you and with the fellow panelists today. So as you mentioned when you were introducing me, the O'Neill Institute is part of Georgetown Law here in the United States. And it exists for many, many years. Essentially what the O'Neill Institute does is thorough research in the intersection between law and public health. And one thing that I wanted to bring to this group is that a few years ago, within the O'Neill Institute, we created the Global Center for Legal Innovation on Food Environments that dedicates itself to thorough research, but focusing on how to promote healthier food environments and the impact that has on health outcomes and equitable health outcomes. So that's essentially what we have been focusing on in the past few years. And one of our main lines of research from the beginning has been around front of pack warning label. We have released a number of analytical reports over the years, focusing in different contexts and regions. For example, one on Mexico, one on Argentina. So it has always been a big focus of our work.
Thank you, Isa. So as advocates, and thank you, I see many advocates who have joined the call today, colleagues from Jamaica, from Bahamas, all over the region. We've been engaged in advocating around this process since 2018, and at times we've been very frustrated with the actual process, the consultative process at the national level, to be quite specific, including the constitution of the National Merit Committees, imbalances in voting, irregularities in voting, and a general lack of transparency at times. So this is, at the essence, this is really a governance issue. And your team is about to release a report on decision-making processes in CARICOM using FOPWL, or this process, as a case study of sorts. I wonder if you could talk a bit more about some of the findings of the report.
Absolutely. Thank you, Maisha. We are indeed about to release this report. And what it seeks is to inform the strengthening of public health decision-making in CARICOM, and we analyze front-of-pack warning labels and the standardization program as a case study. And how do we do that? This report basically outlines, different CARICOM actors, so organs, institutions, agencies that are involved in this standardization program. And we do a deep dive on how these standards are developed, how they're adopted. And we also include some normative considerations. So for example, CrossQ also having a consumer protection objective. And also it has to act consistently with different international obligations. So that's also a big focus of our work at the Global Center for Legal Innovation on Food Environments. We analyze some legal obligations. We see what kind of policy reforms are complied with them or not. And finally, this report issues some recommendations. And you asked about the findings of the report, and I can give a preview. But essentially what we do is look at governance, like you pointed out. And we found that current governance structures that relate to this process, they have several entry points for industry inordinate involvement. And one thing that I want to stress is this, one of our focuses is not to say that industry cannot be engaged or that it cannot be consulted, it can. But what we really want to highlight is the need to balance the scales. So we do include some considerations about, rules to prevent and manage conflicts of interest, which I know was a topic that you brought up earlier in this conversation. And essentially looking at how we can, like I was saying before, balance the scales in order to improve governance processes. And that is very much in line with our mission here at the O'Neill Institute. We look a lot at how the law can function as a tool or as a barrier to improve health outcomes. And that has a lot to do with governance and how we need to rearrange some rules and the way that actors interact with each other in order to make that, a bigger probability.
Thank you, Issa, and we'll come back to that. Samantha, over to you. So Antigua and Barbuda has been steadfast in its support for the octagonal warning label since the vote in 2021. I want to talk about, if you talk a little bit more about why has this country's support been unwavering, especially in light of the considerable, counter arguments we're hearing from some actors in the private sector, arguments that Caribbean people are different and we need to have a hybrid system, et cetera. Why has Antigua kind of stayed above the fray and your support been so steadfast since 2021?
Thank you, Mayasha, and good day to all. So to start, we had a very strong National Mirror Committee, and included in our Mirror Committee were 3 health professionals, all happen to be nutritionists. So that helped for us to advocate even stronger for the standard. In addition, every step of the way, every time the standard came around, our chair, the chair of our committee, was very steadfast on making sure that we had the proper background information. And when things were unclear, the committee even went as far as getting support, or what I should say, not support, but also had PAHO came in and did a presentation on the I think it was Dr. Fabio, he came. And we also, to balance it out, we also had representation from the CPSO study. So those 2 studies were there. They were presented to the committee. And even after that, the committee still, without, real influence, was able to continue to support and adapt. In addition, to be fair, though, as you know, like many of the smaller countries, we are not a strong manufacturing company. We do quite a bit of imports. And there was just one delay one time from our Chamber of Commerce, who asked us to, review the CPSO report before making a decision. But even with that, we were able to still stay with the standard.
Thank you, Samantha. So we have another round of questions. I'm going to go through those, looking at the time and thinking if respondents can try and limit their responses to 2 minutes. Nicole, back to you. And I think you touched on this in your first response, but just to reinforce, because what we've heard across the region in many countries is this request to have almost a hybrid approach, where the standard currently it contains only the octagonal warning label, but there's been a request to include traffic light and magnifying glass and facts up front. What do you think about that suggestion to have almost a menu of options within the standard? And we've heard this, we've talked about it, but I think we need to reinforce, the position on this kind of argument.
Yeah, so the 2 dimensions to the question, right? There's the health dimension, which is when you have multiple systems, you potentially undermine the impact of any one regime, and certainly we wouldn't want to add unnecessary complexity. I mean, one of the powerful things about this system is how simple it is, right? No matter your level of education, your gender, et cetera, you get it, right? But specifically on the trade, though, we made a decision as CARICOM to do this process as a regional standard, precisely because we understood from the very beginning that it really only makes sense if we're all in it together. I remember at the high-level meeting in 2018, I think it was, when Prime Minister Motley was talking about NCDs, and she made the point, NCDs is a regional problem. CARICOM, we have a regional problem when it comes to NCDs, and it necessitates a regional response because we're really individually, it's suboptimal for each of us to individually be trying to solve this problem. We have limited resources, limited capacity, etc. It's better to pool and work together. And we've seen that in many instances, many other instances, for example, with tobacco control. We have a regional standard for graphic health warnings for exactly the same reason. Now, in terms of why we don't want all of these different hybrid models or multiple models operating, what's the problem from a CARICOM trade perspective is having these multiplicity of options then undermines the very rationale of going regional in the first place. Because if at the end of the day, I as Barbados can choose option A, but Jamaica can choose option C, and Trinidad and Tobago can maybe choose C as well, but then, you know, Grenada choose D, then what we have is no longer a level playing field within the region. We have increased friction in terms of the ease of movement of goods, because now to come into an increased cost. So we were talking about costs before, the costs become unnecessarily greater because now I have to have a system for Barbados, but a different system for Jamaica, a different system for Grenada, etc. And so it really makes a nonsense of the whole idea of trying to go a regional process. At the end of the day, the power of the CARICOM process, the power of going regional is that we create a level playing field, we standardize things, and therefore we minimize the fallout that comes from trade. There may be some friction, as I said, as people maybe don't transition fully, etc., but we minimize that by ensuring that everybody knows what they have to do. Also, too, from just a pure business perspective, it's clear, you know, I don't have to invest a whole lot of time trying to figure out what's the system in Jamaica, but what's the system in Barbados, and what's the system, because guess what? It's one system across the board. I just need to get familiar with that system, and I know I can just roll it out across the Caribbean. So it really, the hybrid system or having multiple models would be a big step backwards. It is definitely a backward step and a definite loss from a trade perspective.
Thank you, Nicole. There are some questions coming in the Q&A, and I'll encourage speakers to have a look and answer those. We'll get to them in a moment after we finish with the panel. I wanted to ask Isa a question on the idea that the FOPWL is rights compliant. And, you know, what does that mean?
Thank you, Maisha. That framing itself is a very valuable framing. I feel that for many years in the past, we, you know, have seen people arguing that front of pack labeling and front of pack warning label, in the different models, they can be done when we're thinking about rights frameworks. But what we've seen recently from a few years, from ago until this point, is a really big change of the framing, because what we're seeing now is that actually states are obliged, they're compelled to act based on their rights obligations. So that's the first point that I wanted to bring here. And then I wanted to draw attention to the fact that 3 years ago in 2020, the United Nations, the former Special Rapporteur on the Right to Health, released a statement that was essentially looking into how front-of-pack warning labels were compliant with human rights obligations, like you mentioned, and say that just a few months ago, actually, the current Special Rapporteur, who is Dr. Tlaling Mofokeng, released a report that focuses on food nutrition and the right to health, and she echoes that sentiment. She explicitly says that front-of-pack warning labels are compliant with the right to health and other human rights. And she actually praises countries in the region that have engaged and that have moved forward with their front-of-pack warning label processes, and she calls them good practices. So to your question about what that means, essentially is that this specific policy is a means to realize different human rights. We're thinking about the right to health, but we're also thinking about the right to information, which is a big focus of this, of this discussion. And one thing that I would like to stress is that it's not any front-of-pack label, it's not any front-of-pack warning labels. Part of the exercise that has, that began a few years back and that has now been emphasized with the current report is stressing, the need for these policies to be developed according to the best scientific evidence available free from conflicts of interest. And that is pointing towards the octagonal warning labels that we have been discussing. So I really wanted to emphasize that there are means to realize human rights, there are means to realize the right to health, the right to information, and states actually can be, held accountable for the failure to act in this regard.
Thanks, Isa. I want to turn to Samantha because I'm reading some of the comments in the chat. And a kind of a two-pronged question for you, Samantha. Samantha's first and foremost a nutritionist, so she understands the importance of healthy diets. She also understands the impact that it's having on unhealthy diets dominated by the ultra kind of foods that Fabio spoke about, ultra-processed products, the impact that's having on overweight, obesity, and NCDs. And so the two-pronged question is, do we need these regulations? Do we need front-of-package warning labeling? Do we need taxation, subsidies? Do we need marketing regulation? Why not just educate people? And then the second piece is, will FOPL, octagonal warning label, will it work on its own? So 2 parts for you.
All right, thank you, Maisha. So as we know in our region that the level of NCD is quite alarming already. And specifically to governments, the cost of NCDs is considerably high. And for that alone, we know that education alone at this point cannot work. Maybe if NCDs was not, the great problem it is now, probably we could have started there. But the point where we are at now, education alone cannot work. We need to take a more direct approach to combating NCDs. And I think in addition, we find that more stakeholders outside of health are coming on board and seeing this and realizing that this problem is affecting the whole society. So even though I see the comments, about what about the persons who may not be able to afford certain foods and so on, as a whole society, this is something that we have to work on and be on board. Behavior change can be driven by different factors, but it can be easier if you don't have to work out the math of reading a food label. Even for me as a nutritionist, you have to work it out. And I'm a nutritionist, so I should know better, much less for the average man trying to figure out if something is high in fat, high in sodium. In addition, what about on your school compound? Should the children be able to still work out what is good versus what is bad on their school premises? If they're buying beverages or snacks, what's the best to choose from? And it goes back to what we preach as, healthcare providers. If we're telling someone to, let's say, for instance, you need to cut out sugar or chocolate because it's, bad for your blood sugars, we don't expect them to still have it at home, right? You're not stocking up on it at home because, of course, once it's there, you have easy access. We have to start addressing NCDs the same way in that whole environmental approach, in that, if the environment does not change, nothing is going to change. So that's why taxes, policies, our warning labels are so important at this time. And for the last part of your question, Mayasha, with regards to, just remind me, it had to do with the front of pack warning labels. Sorry.
Basically around the fact that these are foundational policies and they cannot be implemented on its own. So OWL can't stand on its own. Right.
So yes, even with, as I said earlier, even for behavior change, you're going to need more than one approach. Yes, this may be one approach that can work for those who are, doing the shopping, but, the education will always be needed. Our school environment will have to be changed because we're not expecting, our children, especially our young children, to be that much involved. So yes, there will need to be several approaches to addressing this issue. However, I think it's a start that we most definitely need.
Thank you, Samantha. So we're getting close to the time for the Q&A. Before we get there, I had 2 more questions, one for Luis and one for Fabio. The one for Luis is, could you share, 1 or 2 kind of key lessons learned from the Uruguay experience that the Caribbean can take as we hopefully move to the next stage? And then for Fabio, as we think forward, hopefully moving to the next stage, how has industry responded to the labels? And again, this kind of same question with Luis, what can we do even now as we anticipate what we will come up against as we hopefully implement over the next few years?
Well, so thanks for the question. Well, thanks for the question, Maisha. So I think that one of the key lessons that we learn is that most population accepts and thinks this is a good measure. Before the implementation, more than 90% of the population in Uruguay, made on surveys, said that it was a good measure and that it was going to help them make informed decisions and to improve their diets. And that continued throughout the implementation process. And now that we have post-implementation surveys, at least 60% of the population says that they use front-of-pack labels to make decisions at the point of purchase. So that's one of the key lessons that we've learned during the implementation process. And also, I think having all the evidence that we have today for front-of-pack labels is very important. When we began with the development and implementation, it was only Chile and Peru was in the same stage of development. Now we have information from Mexico, from Argentina, from Chile, from Peru. So we have all this evidence, and that not only helps in the development process, but it also helps protect the regulation in front of different trials that the industry will make to these policies. So having all that evidence helped Uruguay win a trial that was in front of an administrative court from a group of importers that say that this regulation was against the Mercosur technical regulations. And what the court said was that the Ministry of Health had all the authority to make this regulation to protect public health, and that Mercosur didn't have anything to do with the Uruguayan sovereignty. And it also, what we learned is that all the many threats that were made regarding companies being bankrupt or products not being sold in Uruguay anymore were unsubstantiated. So today we have probably the same products, the same companies, and we don't have the hard data like they had in Chile that nothing was affected in terms of employment or in profits from the industry. But, you know, we see the same companies doing business in Uruguay. So a strong regulation is necessary, and learning from those that already have implemented front-of-pack labeling. And the more detailed that regulation is from the beginning, the better, because it will be less prone to changes during the way. And also in small countries like the Caribbean countries that are limited in resources, especially in human resources, the more detailed it is, the less time the technical officers will spend responding to questions regarding implementation from the industry. So probably later in the Q&A, we can expand a bit more.
Maisha, I just wanted to quickly jump in, if I may, and just reinforce something that Luis was saying from a broader WTO perspective, since he was making the point about the challenge that was made in respect of the Mercosur process. And Mercosur is, of course, like the CARICOM equivalent. But I just wanted to make the point, it's not even just at the level of our regional processes that it is clear that even when it comes to trade, so Mercosur is a trade arrangement, economic arrangement, and they're recognizing that at the end of the day, there has to be space for health. You know, it is not that trade trumps in every single circumstance. Sometimes health will trump, even though there may be negative trade impacts, which goes back to my comments at the very beginning. And I just want to reinforce that this is absolutely the case, even at the international level. So the WTO jurisprudence is absolutely crystal clear from 2001. It is very clear. And consistently since then, and we've had the plain packaging challenge, which reinforced this powerfully in terms of the interpretation of the technical barriers to trade arrangement agreement in the WTO, that once you can prove that your measure is necessary for public health in the sense of being the most effective means of securing your public health goal, you will have no problems in terms of any conflicts that arise in terms of trade. And so, I mean, it boggles my mind that the preeminent trade organization body, right, World Trade Organization, can appreciate and accept and with no difficulty at all embrace that in certain circumstances, health has the trump trade, and somehow our manufacturers or our certain stakeholders regionally don't get it. That somehow the narrative is that trade must always trump, and that absolutely cannot be the case and is not the case. Over.
Thank you, Nicole. And I wanted, before we go to Fabio, I just wanted to give everyone a sense of what we plan to do to kind of adjust or pivot here, because the webinar was to end at 11:30. We have a short video we want to play, and there are some questions. So this is a very important topic for our region. We're going to push ahead and maybe extend it about 10 minutes past our end time. I know Isa has to leave, so if anyone has any specific questions for Isa, please drop them in the Q&A and Isa can respond to them. And I hope our panelists are fine, because I've not discussed this with anyone, but hopefully you can stick around for an additional 10 minutes. So Fabio, over to you on how industry has responded, what you've seen in other countries that have implemented the warning label.
Yeah, thank you, Masha. It's really the part of the industry that is spending time trying to mimic the tactics of tobacco industry, alcohol industry, is really to try to delay or weaken the policy. So that's they dedicate time and energy and resources to delay or weaken the policy until they can. Once the policy is adopted, then they start to run after that and try to adjust the products and get ahead of the market. But and that's usually the split that we see in the industry sector. We see companies spending their time and energy making better products, and companies trying to, even after the policies in place, trying to litigate against the government and try to avoid the or prevent the population from having their rights ensured. So that brings us to the question on also how they are also trying to keep their target within poor population. So this the discussion brings back to the fact that they make us believe that poor people need to eat junk food, and the ones that really make the point that these regulations should not move ahead are those that probably are not eating junk food. They're eating healthy diets, and they're trying to make sure that populations that are the poor are eating junk food. And we don't want that. We want everybody to have access to healthy diets as part of our mandate. So I think, and then once the policy is implemented, I wanted to clarify on how important it is for companies and how ahead a company will be if it takes that on board and start working given the policies is going to take place. First, no country is an island. Even islands and even countries that are not an island, they're no longer an island. That means if a company is operating within a regulated market, it will make well in that regulated market, and it will make well in different other markets. And that means that the countries that have regulated, they've already preparing their industry to a more regulated market. They're making their industry better prepared to operate in this world. If we're deregulating markets, we're just delaying and putting and increasing the burden of companies in countries that are deregulated, and they can only operate there. That's the only way, that's the only thing they can do. And they actually, instead of opening markets, they're actually closing markets for the companies in the country. So I think this is a reality. There's 11 countries already adopting octagonal warning labels in our region, big countries, small countries, and they're focusing on protecting the public health, and they're achieving that. And when the Caribbean does that, it will benefit the entire population because also the industry is suffering the harms and with all the impact of NCDs. We have data showing that the employees of industry, they also have NCDs. And this is also having a cost for industry itself. Sometimes industry speaks as there's no cost for them for NCDs, and there's also a cost because their employees, they are also people living in the country and suffering from the same problems. So I think it's really important to see regulations as a benefit, as an opportunity as well, not only for the entire population, for all sectors, because without human health, without protecting life, we don't have anything. We don't have jobs, we don't have industry, we depend on that.
Thank you, Fabio. So we're going to pause the panel just for a moment to play a video from a young person who is living with diabetes and her take on why octagonal warning labels are important.
My name is Daria Nichols, and I'm a young person living with an NCD. As a young person living with an NCD, reading nutrition labels for products has become part of my routine. So whenever I see a new product, I always look for the nutrition labels first, and that is a bit time consuming. With the octagonal warning label, it saves time because those living with NCDs will be able to easily identify and determine whether they will purchase a product. On September 16, the Healthy Caribbean Coalition and the National Foundation of Barbados participated in a phantom package warning label call to action. It was important to take part in the call to action because I want those living with NCDs to be able to make the best choice for themselves. While speaking with the public, I was able to see how supportive majority were not to give them the facts. I know we deserve the label that works best.
Thank you, Zaria, for that powerful testimony. So we're going to go, we do have some questions that I wanted to get some time to take a look at and see if I can see them here on my phone. So one of the questions that we have here is, how do we convince the decision makers of our country when there are some powerful businesses with lots of money and influence who also stopped the implementation of the sugar tax? Compared to the sugar tax, is this less invasive? Does anyone want to take that question?
Maisha, I replied to that on by text.
Okay, great. Anyone else have any other comments on that? Basically, how do we deal with the powerful economic actors? And I think part of that goes to Issa's discussion around governance and using tools such as law to create that balance. Issa, I don't know if you want to comment quickly on that.
Yes, Maisha, thank you for the chance to comment on that. I do think it has everything to do with governance considerations and really creating mechanisms and rules of engagement so that we can prevent and manage conflicts of interest. And like I said before, it doesn't mean necessarily that industry cannot be engaged, cannot be consulted, but it does mean that we need to rebalance the scales. And one thing that I wanted to highlight also is that the report I mentioned earlier that just came out, authored by Dr. Tlaleng Mofokeng, has a big section just focused on conflicts of interest. And one of the things that she calls attention to is that nowadays we often hear and mention, multi-stakeholder approaches, but she says that can sometimes overshadow the fact that states are the ultimate duty bearers, right? So I think it's important to kind of end this conversation with this note and really, call upon states to act. They are ultimately responsible for promoting and protecting the population's health. And that includes, pushing forward and this kind of policy reform.
Yeah, I think that's an excellent point to end on, and it triggers my thinking of Sir Trevor's comment. We've moved from multi-sectoral engagement to multi-sectoral governance, and the impact that that's having, and where does the responsibility lies with the state. Another question here is, but many of the food manufacturers have a physical presence in the countries like Mexico and Latin America. Our markets in the Caribbean are small. So what about the imports coming in from the US? It's a very specific question on US imports. I don't know if anyone wants to take that one. Fabio?
I had replied to that as well, Maisha.
Oh, you did? Okay. So I'm getting questions.
They can shift, but equally just use the stickers then. It doesn't have, the product, nobody's stopping the products from coming from the US. All you're saying is if they're coming from the US, they need to carry the label. And so either the manufacturer themselves makes the change. And we've heard from Uruguay that that's not as inconceivable as our private sector partners might want us to believe. But then also too, we've also learned that even if it is that changes aren't made, we know that we have options in terms of using stickers, etc., where the product will still get in, but it will be then compliant with the requirements for our market.
Thanks, Nicole.
It's a false conflict. In other words, there's no conflict there. The product can come in, it just needs to carry the label.
Right. And Fabio, I think you wanted to add to that?
Yeah, I just wanted to add that companies already need to comply with the legislation of the countries they are importing to. So it doesn't change any of the situation. So a country, so if the US is exporting into a country, whatever that country is, it needs to check the legislation of the country and comply with that legislation. This is already done for all the countries they trade with. So once the Caribbean countries adopt the legislation, they will adjust their products to the legislation. And this can be done, and has been done in all countries with no effect to continuing the trade.
Thanks, Fabio. Another question we had was just, I can respond to this, anyone else may want to, is trade involved. I think those of you who may not be familiar, 12 of the countries, the cross-Q identifies 12 countries who then will participate in national or lead national consultations through what they call a National Merit Committee. And this National Merit Committee has membership, which does include, or is meant to include, it's meant to be multi-sector from diverse sectors and diverse actors, and it is meant to include trade. So in many countries, trade has been a very active member of the National Merit Committee, participating in the kind of deliberation process. The next question is from Simone Bishop Matthews. And supermarket associations or equivalent groups contribute to the promotion and marketing of ultra-processed products, especially for the back-to-school period. What strategies do you think could be used to reduce potential pushback post front-of-package warning label implementation? So here we are again looking forward. How can we plan in anticipation of the kind of pushback that we may get? I don't know if anyone has any lessons learned. I think Louise talked about the importance of the public being engaged and the public supporting. Anyone else? Louise, go ahead.
Yeah, I think having a strong and involved civil society in each country is very important to support these regulations during implementation, because they not only continue on reinforcing the narrative of the importance of front-of-pack labels, but they can also help the government in the enforcement process, because they can present denounce those companies that are not complying with the regulation. And so I think that's a very important part of the topic, having a very strong involved civil society that has all the evidence and the strength that, for example, HCC has in the Caribbean, and then Mexico had with El Poder del Consumidor, and other countries had with their own civil society organizations.
And I think also, Maisha, it goes to questions of enforcement and monitoring and evaluation. And that's kind of, so Louise talked about the government, the civil society role, but government has an obligation and a responsibility to ensure that the system is properly monitored and that there are consequences for failure to comply with the regulations. And so, the idea is people do what they're allowed to do. And so if it is our regulations are clear that you're not to have these products, or they must have, the labels in order to have it, which is more accurate, then there needs to be within our regulation space some built-in, some element that speaks to periodic check-in, looking at supermarkets. And it's something that our ministries of commerce are already accustomed to doing. I mean, we have capacity constraints, but front-of-pack is not the first regulation that we have in the food space. Certainly even when we think about things like, which has a much greater impact, any product that comes in, packages that come into Barbados, for example, must be in English. All the ingredients, all the, so even if it's produced in Turkey or in Latin America or somewhere, even if it normally comes in a different language, it must be in English. And our Ministry of Commerce has a system of, monitoring that in terms of looking to see who is compliant or not, and if things aren't compliant, they're supposed to be pulled. And so, you know, there's the civil society role, but at the end of the day, it goes back to Izza's point. You know, the ultimate responsibility is governments, and we have to hold our governments accountable. You know, enough of this, lots of talk and then not following through, or allowing, you know, people to maneuver and exploit areas. If we're serious about our children, if we're serious about improving the health of our region and improving our overall development, therefore, as nations, our governments need to step up to the plate and make sure that these systems work.
Thank you, Nicole. Well said. Samantha, your hand is raised. We're going to wrap up.
Yes, I just also wanted to add that we have some precedents with this, especially when it comes to the code of marketing against breast milk substitutes. And, you know, in our country, as everyone has said, it starts with a strong policy. Once you have a policy and it is enforced and monitored, persons will comply. We have had persons try to put things in the paper, companies, and we had to reach out to them and they retracted. And, you know, it's based on, they're like, well, where is the policy? You show them the policy and they're like, okay. And they pulled all the marketing stuff from our clinics and schools and so on. But you must have a policy, a strong policy. So it has worked in the past, and I believe it can work again with this.
Strong point, Samantha. So I promised 10 minutes. We're gone over a little bit. I'd like each of the panelists to think of one single takeaway, one thing that you may not have had the opportunity to say, a message you'd like the audience to go away with. We still have 175 people strong who are still watching and paying attention. What's your one message you'd like them to take away? And I'm going to start with Nicole.
Okay, front of pack warning labels is an important health measure, and trade is not a barrier to its implementation.
Thank you, Nicole. And I'm just going to go clockwise then. So next we've got Samantha.
I also wanted to add that we don't recognize how powerful we are as a grouping, as a community, as a CARICOM community. Through this whole process, I've realized that having all the stakeholders on board has made a big difference. So don't think we're not getting anywhere. We are getting somewhere, and hopefully we'll get there sooner.
Thank you, Samantha. And Isa.
Thank you, Maisha. I guess my takeaway is that sometimes we focus on whether, you know, from a legal perspective, this kind of policy reform is acceptable, it's rights compliant, and the answer is yes. But what I wanted to end with is the fact that status quo is not acceptable from a rights-based perspective. And we do need information that everyone can understand, that it's easily accessible. Thank you.
Thank you, Isa. And Luis?
Oops, sorry. I think in order to move forward, you need leadership, that I think the Caribbean has it. And I think we need evidence, that we have a lot of evidence on front of pack labels. So we just need to act on it. And as Nicole said, hold our governments responsible for protecting the health of their populations.
Thank you, Luis. And finally, Fabio.
Well, thank you. No, I think just to stress that the octagonal warning label is the best performing system to help consumers in making a healthier choice, and also to help them decrease the consumption of products that are not food or ultra-processed products and processed products high in these sugar, sodium, and fats, and get people to eat more food as part of their right and protect of public health and healthy diets. Thank you.
Thank you, Fabio. And I'd like to thank all of you who joined us today. There's such an active and engaged chat group. The question and answer was very active as well. If there are any questions that we did not answer, please feel free to reach out to the Healthy Caribbean Coalition, any one of our staff, or hcc@healthycaribbean.org, or you can see their number of partners: PAHO, the OECS Commission, CARPHA, Caribbean Public Health Law Forum, and UNICEF. Reach out to us and ask any questions you would like. I think, as Samantha says, we've really proved the power of coalition, and we are all supportive and behind the octagonal warning label. I'd like to close by thanking again the team at HCC and the team at PAHO for pulling this webinar together. I hope that we've achieved our objective, that you all feel that you understand FOPL better, you understand why the octagonal warning label is the label that we deserve. I think I'd like to thank you again for all attending. Thanks for the support of partners. One thing I would like to say I was quite heartened by, as I saw a comment in the chat, saying that, I don't know which country it was from, that they were very encouraged and they felt very informed by the webinar, and they were going to go home and advocate for the octagonal warning label. So that in of itself says that we've achieved something major over the course of this webinar. So thanks very much again, and we look forward to hopefully a positive vote on October the 14th and the next chapter. Take care.